Hi, my name is George Bruder, and thank you for joining me today for a restoratively driven path to endodontic excellence. My mentor, Robert R. White, 3 decades ago said, "Root canal treatment is not complete until the tooth is restored to function." I'd like to take that to the next level and review Tamsey's study, which showed us that endodontically treated teeth that are extracted, the highest frequency is those with restorative failures, restorative complications. 43.5% of all endodontically treated teeth that get extracted are extracted for restorative reasons. This is something we need to review and refine in the way we think about endodontics. We also have to remember Richard Schwartz. We have to remember that patients are not well served if the endodontic treatment is successful, but the tooth fails. We also have to remember Neil Kishin's study where he talked about remaining dentin tissue and the need to actually preserve as much as we could, so obviously we could keep more tooth structure and prevent more fractures. So what are some of the restorability considerations that we have? In my retreatment chapter with Robert R. White, a few of the bullets that we discussed was 1, can we keep a sufficient dentin thickness? 2, are we going to have an adequate ferrule? And 3, of course, is there sufficient crown to root ratio? What are we measuring and how do we maintain what we have? When we go to the next thing, we start talking about tooth structure coronally, we have to start thinking about Clark encotomy, for example, where they started to shift the overall focus from the cervical area to the cervical area of the tooth and create awareness for an endo-restorative interface. This is one of the papers they wrote in 2010. When we think about that paper, as you can see here with the blue arrow, you have a gouging. That gouging is consistent with one of Cotomi's statements, which says we should not refine our preparations, our endodontic access, with round burrs because they are prone to gouging. If you look at the yellow arrow, it also talks about the overextension and expansion of the coronal segment of the root canal system. Now here you see an over-preparation. Now this is really sensitive in a mesial root of a lower molar, for example, because of the distal concavity of the mesial root. So one of the things we want to do is make sure we preserve as much as we can while obviously achieving our goals. Agarwal and their group said, protect pericervical dentin. So what is pericervical dentin? Pericervical dentin is approximately a 3 to 5 millimeter range from the crest of the bone coronally and apically. This area is the key to maintaining the tooth for a longer period of time. By maintaining this tooth structure, this dentin, we can actually preserve the natural dentition for a longer period of time. So what are some of our tools? What are our challenges? How do we address these issues? Well, 1, we have to start thinking about preserving this structure for strength. Also, we need to create things that provide flexibility, not only as a file, but also in the way that we treat patients and accessing patients and posterior teeth. We need to have flexibility, but also provide efficiency. Efficiency in cutting and efficiency in overall treatment by making things simpler and more predictable. We also have to make sure that we create something that has a smooth transition within the system. That way, we have it where we're not changing motors nonstop for each file, and also so you have a good feel and you don't have torque changes throughout the entire system. And that's one of the things that Ove Peters and myself and the engineers from Dentsply Sirona are happy to bring to you. A complete solution. What we need to do is we need to think about some of the things that we can do to modify this. So, for example, if we're accessing posterior teeth, one of the battles we all have is obviously limited openings with patients. Patients with fibrous connective tissue disorders, like scleroderma, and numerous other things. One of the things that we actually came up with was obviously what part of the file works, and why do we make them as long as we do? Not in the cutting flutes, not in the blank, but actually in the handle. So what we've done now is we've created a system that now only has a 9.5 millimeter handle. This allows us to get into areas that we couldn't before. So if you measure from the bevel all the way back, it's approximately 9.5 millimeters, and from right above the bevel, it's approximately 8 millimeters. This allows us easier access into posterior teeth. It consists of 5 uniquely designed instruments that are not always required for each case, but are there in cases that require it. Because, as my mentor always used to say, canals are like snowflakes and there are no two alike. We also have to remember dentin removal. only where we need it. The great thing here is, compared to continuously tapered instruments and those that were progressively tapered with larger tapers, we now have something that has a conservative coronal shape. And if you look, you actually have a consistency because the blank up top of this instrument is only approximately 0.8 millimeters. This now also, with the appropriate apical shapes you desire, you now use those with the coronal modifier, Orifice Modifier, and the glide path file, and you feel a smooth transition throughout the system, going from the Orifice Modifier to the glide path file to your shaping file. When we talked about the flexibility, we wanted to see how much force is really required to bend the instrument with this new heat treatment. We obviously have an instrument that's much more flexible. The great thing about this is, because it has less memory, we don't have spring back. As a result, you can maintain the natural morphology more readily, and you're less prone to things like ledging. What we want to do is we want to make sure that we make an instrument that is flexible, but at the same time maintain efficiency, which has been one of the battles throughout instrumentation design. One of the key things is the handle. And here, it allows us to have greater accessibility when we only have a 9.5 millimeter handle. Now, a typical handle, as shown here on the left-hand side, when you place it into one of your contra angles, you don't realize it, but much of the handle is sticking out. Now, even though you might have a 21 or 25 millimeter file, you actually have a longer length from the contra angle going to the tip of the instrument. This here limits even more of your accessibility into posterior teeth. Well, what we've done is we've created a handle that's shorter, so now you're utilizing the entire cutting surface, as well as now the length indicators coming all the way up to the contra angle. So now you're not limited by the length of the handle. You're only using that part of the instrument that's being used, and obviously that is being used for measurement. So now we have a solution that allows us even greater flexibility in handle length and flexibility of material, so that way we can access these posterior teeth more readily. The instrument family consists of an Orifice Modifier. One of the key things here, for those of you that were familiar with TrueShape, is this is something that Ove and I have actually just taken to the next level with new metallurgy. But for those of you that remember, we wanted to always have something that was more flexible from D0 to D4, so that we maintain that natural morphology in the coronal segment. But then once you hit D4 through D7, because it only has 7 millimeters of cutting flutes, you have something now that is an efficient shaper, this being called an Orifice Modifier and not an Orifice Shaper or obviously opener. It's modifying that coronal segment. And that leads us to the next thing. Why an Orifice Modifier? The key thing here is we have to remember that throughout all instrumentation, we've learned that the glide path you create is the only thing your shaping instruments can follow. This goes for all rotary instruments. So the key is to create both a coronal glide path, a receptacle for your next instrument, as well as a glide path from the apical segment all the way up. The Orifice Modifier fills that void in the coronal segment, which allows us obviously to scout more readily and obviously to confirm a working length that's actually consistent throughout the procedure. One of the things we want to do is we want to also tell you that this here falls into the PCD for those of you that are looking for something for pericervical dentin preservation. We have to also remember the key, and one of the advantages to having a flexible instrument like this from D0 to D4 is it now follows those cases where you don't have a canal orifice that's sticking straight up. It follows that natural morphology. The key is we don't want to remove unnecessary dentin. Also, no brushing. This here is a low torque instrument. It's run at 500 RPMs, and I'll go into that in just a moment because all of the files run at the same exact speed and torque. When you use the instrument, think of it as a wave of motion. You no longer want to peck, you no longer want to go to resistance. You want to take all these instruments in and allow them to float in, and you want to do 3 very gentle waves of motion, always advancing past the last place you were at. Remember, if we were at the beach and a wave was to roll in and the wave kept hitting the same part of the beach, you'd end up, unfortunately, with beach erosion. So what we want to do is we want to take these instruments that have less memory and we want to take them into the instrument, we want to recede a little bit, and then we want the wave to go a little further, recede again, and for a third time, go a little bit further and out. And that's the necessary thing for us to understand. This process of scouting with a viscous chelator with a hand file, and then later preparing this top, doing a coronal modification, is done with an irrigant. So remember, if an instrument spins, irrigants win. A viscous chelator for hand files, a lubricant when using anything that spins. This cuts down on friction and temperature and also allows for more debris to come out of the system during your instrumentation and shaping. Here, this is the Orifice Modifier. And one of the key things I want you to note here is, one, that we are not just going to resistance. There are 3 consistent, very predictable motions that we're doing. We're not going to try to go past 3 to 5 millimeters. We're going to do them nice and gentle. But here, as you can see, in this case, look at how the debris comes into the coronal segment, into the pulp chamber, because we're using an irrigant as our lubricant. So one of the things we want to make sure you remember is, before irrigating your canal system, always with the same needle and same irrigant, always rinse the chamber and then irrigate the canal. By rinsing the chamber, you're removing this debris and you allow for a gradient to go from higher concentration to a lesser concentration, therefore removing more debris from the canal system during your shaping. The instrument family also consists of an extremely flexible, average taper of O2 glide path file. This is used obviously after you've confirmed your working length with your apex locator. And for those of you who like to confirm patency, I would do that also before confirming your glide path. Remember, it may take you approximately 2 or 3 sets of 3 to gain your working length. But our recommendation is going in 1 recede, 2 recede, and 3 out. Rinse the chamber, irrigate the canal. Recapitulate and enter again as many times as necessary to gain working length with the glide path file. The glide path file is extremely flexible. It will maintain its natural morphology in the canal system, conform to that anatomy. Also, we have to remember that now, because of these metallurgies, we don't have some of the predictable things that we saw in those stiffer instruments in the past. And that's one reason why we like low torque. We want to maintain these natural morphologies, but also remember, if you look at the instrument, you'll see there's an offset. That allows it to conform more to the anatomy because, as we already know, canals are not a perfect tube. So we need to appreciate these tissues and preserve as much of it as possible. All the instruments in the True Anatomy system have a 9.5 millimeter handle, as I mentioned before, and the glide path file is no exception. The next thing we want to do is talk about our shaping. So after you've scouted the canal system, done a coronal modification, irrigate it by rinsing the chamber, irrigating the canal, confirmed your working length and patency as needed, we then confirm our glide path. Once this has been done, we then are now ready to shape our canal system. And what we want you to do is always start with the prime instrument. When you're ready to instrument and shape the canal system, always grab the red. So it's easy to remember, when you're ready to shape, grab the red handle banded instrument. This instrument will be used just like the Orifice Modifier and the glide path file. You're going to try to obviously go with simple waves of motion. 1, 2, 3, out, rinse the chamber, irrigate the canal. That is considered a set. So 3 reps equal a set. It will take you approximately no more than 3 to 5 sets on an average tooth to gain the entire length to your confirmed working length that you did with your apex locator. Once this is achieved, your shaping objective is completed. One of the things we have to remember, though, is we understand that some cases may have S-shaped curves, dilacerated roots, short radiuses with great angles, and as we all know, the shorter the radius and the more severe the angle, this is when you actually increase cyclic fatigue. So one of the things we want to do is we want to actually have another option for you. Even though you start the case with prime, you may find that in a small percentage, the prime doesn't go to length. And in these cases, we have a 20. That is a yellow banded instrument with a yellow stopper. The great news is, after using the 20, we found that it creates a larger glide path that's centered in the canal system, and the prime almost always follows after it. So if you need a smaller instrument, it's there for you. But also, if your desire is on a premolar or anterior tooth or a posterior, we have a medium. This instrument is a 36. The key here is, remember, some cases are going to be larger in the buccal lingual dimension. And in these cases, Ove and I have always, ever since TrueShape, told people, treat it like 2 separate canals. When you have a large canal, whether it's the distal root of a lower molar or a premolar, and you have a wide buccal lingual or buccal palatal dimension, think of it as 2 canal systems. You'll actually make more canal contact, and also you'll remove more debris. So now that leads us to something that you've probably seen on the previous slide, and that's the small letter V. The V stands for variable. Now, over the years, as you can see here, we've had a long history with ISO. Obviously, going back to hand files of being an O2 tapered. And also don't forget, we also had profiles when they changed to 04 and 06 constant tapers. And then later Pro Taper, which many people call progressively tapered, but in reality is a regressively tapered instrument. What we want you to understand is that the V stands for an average of the taper along the entire cutting flute area. On your shaping instruments, that's 16 millimeters. On your glide path file as well. The Orifice Modifier only has approximately 7.5 millimeters of cutting flutes. The key though is when you see the V on the glide path file and the shaping instruments, that is an overall average of the taper. But also, V stands for variable diameter because it has the ability to actually conform because of the offset. The next thing we want to remember is how this can conform in the world that we live in, which is a three-dimensional canal system, and how this can be a benefit. We want to remember that this instrument, when used with irrigants, will make more contact and allow us to get out more debris. Also, let's review the Orifice Modifier and its dimensions. D0 at the tip is a 20 tip. We recommend scouting with a 10 file, which is also a purple handle, and once using that hand file, convert over to an irrigant as your lubricant. Remember, after your purple handle, which is the most common that people scout with, and it may require, your case may require 6 or an 8, but after that, we then recommend the Orifice Modifier. You're going to use that in waves of motions as described earlier. 1, 2, 3. You'll see more debris in the chamber. Rinse the chamber, irrigate the canal. When you're irrigating with the canal, also remember to always irrigate on the outstroke for safety and obviously consistency. Also, what I'd like to talk about is obviously the glider. The glider has approximately 16 millimeters of cutting flutes and comes with length indicators. Length indicators that you're all familiar with. Located at 18, 19, 20. There's normally a skip on a 25 millimeter file. However, on a 21 millimeter file, you'll just see the handle at the 21 millimeter mark. The 25 will be 18, 19, 20, skip to 22, and then you'll actually see that 25 is your measurement underneath that bevel of the handle. I want you also to remember our overall maximum flute diameter of being only 0.80 millimeters. This allowing us to obviously address current situations and the things that we now know about endodontics and strength. Its overall remaining dentin thickness, and this fits into that. So, next, the prime instrument. The prime is the shaping instrument that you use on all cases following confirmation of your glide path. However, as mentioned before, if you need a smaller file, it's available, the size 20, and if you need a larger, there's the green, the 36. The prime has a tip diameter of 0.26 millimeters, and it has an average taper of 0.04. However, remember, its greatest taper is in its tip for only 2 millimeters. It is a regressively tapered instrument, meaning its taper is decreasing as you go from the tip back to the end of the cutting flutes. The prime is a parallelogram, as is the glide path instrument. It's an offset. It is centered obviously upon the long axis. When we need additional instruments, we have them available for you, yellow, red, and green. But remember, your shaping objective should always be started with the red, the 26. Next, that brings us to irrigation. We need to make sure that we follow Chow's rules of a 30 gauge needle, understanding that if you have a 20, 25, or a 30 preparation, you should always use something like a 30 gauge. However, our limiting factor until now has always been the material, because unfortunately many of the needles that we actually use are metal and they don't go around curves well, and especially in small preparations there's resistance as they go around those curves. However, now we're pleased to introduce True Anatomy irrigation needle. This is a plastic flexible needle that has two ports at 180 degrees to one another. This is a close-ended needle that many of you are familiar with, just like ProRinse, but the two ports are placed back from that tip approximately at 1.5 to 2 millimeters and also come out at 180 degrees.